Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And a huge purpose of this channel is your empowerment to make good decisions for yourself. And I've maintained this premise through my entire career, which is basically I advise my patients the exact same way I would advise my closest family member, including my wife, who's basically in this age group where all of the things that are on your mind are on her mind, all the changes related to aging and all the approaches that are used to defy aging, restore aging, all of that good stuff between skin and facial shape is all part of, her consciousness. And everything that I'm explaining to you is going to be basically the things that I recommend and advise for her. So coming from that perspective, the topic for today is what are the big money-wasting mistakes that you can make if you're trying to lift your face. Okay, so this is a big topic. Some of it might sound a little controversial, but again, this is my opinion. I have a right to it. You certainly can drop your thoughts down in the comments below, challenge them, agree with them, however you want to go about it. Let's get a lively conversation and dialogue coming. But let me also premise it by saying this. Every time there is a new device or a new concept or a new strategy, I've either done it in my own practice or I investigate it after 1 or 2 years of it being on the market by contacting friends and colleagues literally around the country and the world and getting their opinion about what the value or the efficacy of the product or procedure is before bringing it into my practice. I feel, again, at the end of the day, remember premise one, if it's not good enough for my wife, it's not going to be good enough for my patients. So I am not an early adopter. I am certainly not somebody who just jumps on the first marketing claim that comes around. I'm careful. I want to protect my patients. I want to make sure that whatever I advise, they're going to see the results that they're expecting to see. So that's where I'm coming from. So without further ado, let's break down some of the things that I think are huge wastes of money when you're in a position where your face starts to sag, which is basically most women who are in their late 40s and early 50s, in the perimenopause and menopausal years, as well as men who are aging at any point in time, but basically when the face sags. And what that means is, like, when you go in the mirror and you do this and you're like, oh my God, that looks more like I used to, that is the kind of thing that you're trying to address, sagging, right? So without further ado, let's break it down. Let's talk about money-wasting procedure number one. All right, so number one is thread lifts. Now, for many of you who are relatively new to the market, you might think the thread lifts are kind of a advance. It's a new procedure. Oh my God, what a cool way to, avoid having surgery, etc. Here's the deal. Thread lifts have been around for over 20 something years. They first hit the market actually when I was a fellow back in the early mid 2000s, and they hit a huge splash.
A groundbreaking technique called thread lift.
It's called a thread lift. It promises instantaneous results. It takes about 60 minutes, really.
Basically, you can see these 5 prongs at the tip of it, about the size of a dime, and it's attached to this bioabsorbable leash.
They're called contour thread lifts. There was a big company, tons of marketing and money behind it. And what ended up happening is surgeons like myself, as well as, almost everyone in the industry, started using them. What we discovered back then was it's not really effective. It's a very strange concept. You're putting these barbed sutures into the face and then hiking the skin back up to you, and the barbs catch the soft tissues, and it's supposed to kind of hold everything up. But then you get all this bunching in these areas. It's painful, it's uncomfortable. And then in a short period of time, everything kind of relaxes and goes back to the beginning. But back then, the sutures were non-dissolvable. So the people were having these permanent threads sitting in their face with barbs in them. They were uncomfortable, that were kind of they would catch weird ways, so it would affect certain movements. Suffice it to say, it didn't take long before everyone changed their tune, stopped doing them, patients stopped wanting them. The company went probably bankrupt. I don't know, it just sort of disappeared. I did like a handful of them and I realized what a dumb procedure it was and I stopped. And then the landscape was pretty clear for a long time. There was no thread lifts really being advertised, etc. And then just recently, not that long ago, maybe 5-6 years, I lose track of time, came the PDO threads, which are dissolvable threads. These came along and again, same idea, same splash, big marketing, blah, blah, blah. What do we see? We see basically almost even worse results because these are dissolving threads. They don't stick around. They're meant to go away in about 3 to 6 months, and so do the results. I actually did an entire video on this and talk about this in detail, but studies that have been done on this show that not only are the results not lasting, they also have a pretty high complication rate. And complications come from infection, they come from like nerve damage, they come from just tweaks and weird kind of pulls on this area. I can't tell you how many times I've had to fish these out on patients. It's just not good. So this next generation I never touched, never went near it. Just, people do it on their own. I talk about it from my opinions on it. And whenever I do on Instagram and things like that, you just get hundreds and hundreds of comments about how they agree with my perspective because they did it. So when I'm coming to you with this information, it's not just from my own experience, it's also from the experience I gleaned from my own patients, etc. So thread lifts, huge waste of money. The fact of the matter is it doesn't last. There's complications associated with it, and it's just a dumb idea. When you have laxity problems, when things are starting, it's happening at the deep fascia level. There's also excess skin that comes along with it. This all needs to go up and the skin has to be trimmed off. But we're going to talk about the optimal approach at the end. So thread lift's a big waste. Now let's talk about the next big waste of money. Number 2 is energy devices. And what I mean by energy devices are things like Morpheus 8, oil therapy, Thermage, you name them. There's literally hundreds of these different names that have come and gone in the last 20 years. They claim that they're going to put energy into the deeper tissues, and the deeper tissue is going to respond to that heat, and it's going to tighten up, or the skin's going to tighten up, or something along the lines are going to tighten up, and you're going to basically lift the face as a result of it. Now, in theory, good concept, right? I mean, we all know based on physics and tissue interaction that heat will cause shrinking of the tissue, but heat also causes breakdown of good soft tissue like fat. Now, problem is that right at the anatomic level where there's fascia, there's also beneath there's nerves. So when you're putting heat and deep energy at a level, either you got to do one or two things. Either you got to be bullish and just go all in on it, tighten up that deep fascia and risk frying up some facial nerves along with it. Never a good thing, right? I mean, no one wants to go do a non-surgical procedure and come out with facial nerve issues. Or you're going to back off on it. You're just going to go sort of deeper than the skin and then hope that there's some tightening effect that's going on and play it safe. Well, if you play it safe, guess what? You're basically delivering all that energy into the fat tissue. And that fat that's underneath your skin is important for a supple, youthful, beautiful look. You do not want to mess with that fat. And again, so many patients that I've had came to me asking me for fat transfers, etc., because after they had 1, 2, or 3 of these treatments, they're like, wait a minute, I actually look older. My face looks like it's lost that suppleness and youthfulness and that freshness. And sure enough, but the problem is I can't put fat in the subcutaneous space. I put fat in deep spaces. So I can't replace the volume that somebody has lost as a result of these devices. Now, put that on top of, and so this is a risk or a complication, put that on top of the fact that it really doesn't change anything. I mean, literally doesn't change anything. Then, and even if it does, it's kind of a temporary, because even if you do kind of like thermal shrinking of tissue, it's not a permanent, reduction of the tissue. It's kind of like a tightening effect that happens, and then a relaxation happens. And when that relaxation happens, you go back to baseline. So you're doing all of this, you're paying all this money, you're doing multiple treatments usually because they ask you to come back and do like 3 treatments or sometimes 6 treatments or 2 treatments, whatever it is. And then you come back and you're like, I don't really see much of a change. You're kind of bummed. Then you start to question everything. But you can ride that ride for a pretty long time because it's like, oh, give it time, it'll get better, it'll go better, and it usually doesn't. Again, I learned this from talking to people who do these procedures and from my patients. That's the evidence for why I never brought one of these devices into the practice at all. Number 3, fillers to lift the face, AKA liquid facelifts. All right, so you may be familiar with that term, or you just may be using fillers or heard about using fillers to, kind of quote unquote lift the face. And a lot of them are actually, the name is lift, right? Here's the problem. 100% we lose volume with age. but we don't lose it in the areas that you usually add volume when you're trying to quote unquote lift the face with filler. You lose volume in your temples, you lose volumes under your eyes, around the upper eyelid, you lose a little bit of volume down here in the pre-jowl region, your lips shrink up a little bit. But when you're doing these like liquid facelifts or like a non-surgical filler-based lifting, where you're putting the fillers are in this part of the cheek to kind of like, do this effect to it, kind of bring this up, you're adding it along the jawline. Now remember what I said earlier in many of my videos I talk about the way the face ages. The way the face ages goes from like a heart to more of a rectangle. It slides down, the bottom gets heavy, right? And the top gets thin. That's because the soft tissues are sagging. They're not getting deflated, they're sagging. When they sag like that, and you're putting more filler down here to try to put some filler in the jawline here and here to try to mask the jowl that's hanging over the jawline, or put a bunch of filler here to kind of like do this, what you're doing is you're just basically taking the face and making it a wide rectangle as opposed to a thinner rectangle. You're making it heavier looking. And if you continue doing these procedures over and over again, because remember the aging process is just continuously getting worse with time. So tissues are continuously sagging more and more and more. And then you go back and you say, I need more filler, I need more filler. And the injectors are just, doing this and more, with 6 months you're coming in to get more. Before you know it, you start looking like a pillow. You start looking weird. And we see this all the time, unfortunately. This is like a new phenomenon. It's like the post-filler kind of weird look. The whole reason everyone's afraid of all this stuff is not to look weird because of a facelift that we know can make people look pulled and tight, etc. And so we're doing these things to avoid the look of the facelift, or because we're like, hey, we don't have a lot of money to spend on a facelift, therefore we're gonna do these things. But who wants to come out of this thing looking weird because of fillers? And who wants to come out of this thing wasting money and not getting a lift or buying time towards a lift? So bottom line is that whole concept, and this is one that I can speak personally to because I'm, as a fat transfer surgeon, had the paradigm that volume is an important part of the whole story when it comes to kind of facial aging. Spent a lot of my early, days of my career using fillers in these ways. It didn't take that long for me to realize that I was in the wrong path and I was doing the wrong thing. But I did it. I did the wrong thing, and I admit it. And so I stopped doing it, and now I'm telling you that that is not a viable approach. When the face is sagging, that's not going to help you by putting more volume into it. So let's talk about the next one. This might surprise you. So number 4 is the mini lift. All right, so I'm not just bagging on non-surgical treatments. I'm going to talk to you a little bit about surgical treatment. So the mini lift became this notion, again, born out of the idea that if you do less to a face, you're risking the person looking weird from a facelift. Now, true, but a mini lift can mean a lot of different things. And for most cases, it just means like making an incision, in the same position you make for any type of facelift, pulling some skin or putting a couple stitches in the fascia and just kind of like tightening it up more or less kind of sideways, trimming a little bit of skin and calling it a day. Well, the average person who does this is not interested in a little bit of change, right? No one wants to go through surgery, downtime, an incision, and get a little bit of change. What they want is big change, but they want to look natural, right? That's like what everyone wants. They want a big change and look natural. You're not going to get that with a mini lift. Just to be clear, even though you're having surgery done, you're not going to get that. So mini lifts really popped off in the early 2000s, maybe even in the late 90s, and have been gradually losing steam and losing popularity for a good reason. They don't work. They simply don't work. They don't work both in the short term, but really don't work in the long term. So what we see is a patient who gets a procedure like this done, a year and a half later, they're like, I don't know, nothing really happened. I look exactly the way I did. Now let's talk about real solutions. So let's actually talk about real solutions. So this is what it comes down to, folks. Now, I'm going to be understanding and sensitive of the reality that most patients who choose to go down these directions are doing it because cost is important and money is, a consideration. But here's the deal. If you're in that position, the last thing you want to do is waste your precious resources. You do not want to waste money on things that aren't going to work. And year after year after year of doing these treatments, trust me, just do the math and play out the numbers over a 5 or 10 year period. You will be shocked how much money you will spend on fillers and threads and lasers and things like that, you're gonna probably be able to pay for 2 facelifts throughout that period of time. I'm not kidding you, just simply do the math. It just doesn't feel that way when you're doing it like a $3,000 here or $2,000 here or $5,000 there. It just adds up. And trust me, I mean, our practice, we did fillers in that way for a long time. Patients would spend $3,000, $4,000, $5,000 on just fillers alone. And that's being conservative on the treatment plan. I've heard patients spending $20,000 on fillers. It's not uncommon. So here's the deal. When it comes to laxity, when it comes to your late 40s and early 50s when this stuff is happening, just know at some point in that range of time, you need to have a properly done lift. What properly done means at this time now is basically a deep plane approach for the most part, or even if it's not a deep plane approach, you need to be with a surgeon who has a technique that is gonna address the parts of the face in a substantial and successful enough way that you're gonna get a real change, because everyone wants to see their jawline and neck look awesome and youthful, because that's really why anyone's doing any of this, is because they don't look the way they feel. They look older than they feel on the inside. It's usually like they feel 30, but they look much older and they want to restore that gap again. So it behooves you to do your homework, properly investigate the surgeon you're gonna do, look at their outcomes, look at their techniques, et cetera, and we've done a lot of videos on this as well, but I'm gonna just summarize real quickly here. I consider the deep plane the best of all worlds, in the sense that this is my own evolution. I didn't start off doing deep planes, but I've always done a good facelift. Deep planes just made my facelifts better because I get a bigger lift, and by releasing all the ligaments and all the things that are part of the deep plane, you get a more dramatic and substantial elevation. Looking natural should not be your fear of having a procedure like this done. It should be your fear of not going to just anyone to have the procedure done. That's for sure, because as all of you know, I don't care what state you're in, what city you're in, you walk into any restaurant, you walk into down any street, you're gonna see some weird looking people who've had facelifts, and that's the stuff that scares everyone. It scares the husband, scares the kids, it scares the women who are getting it done, it scares everyone. But as you see from our outcomes, the vertical restore is an incredibly natural looking lift, right? But there's other surgeons who do procedures that have a beautiful and natural looking lift as well. You just gotta investigate, you gotta look carefully. But don't settle. One of the most expensive mistakes you can make is having a surgery with somebody and then coming back and having it done a year or 2 later or 3 years later because you're not satisfied with the level of correction. Now that can happen with me as well. Certainly, nothing is perfect, but we're making it as perfect as it can be, given the circumstances, by doing the most sort of involved procedure, the most elaborate procedure, and then doing it in a vector that looks as natural as it can be, which you see, by our before and afters. So, my friends, I'm very passionate about this topic. I'm very passionate about you and making good decisions for yourself, and I hope that this information gives you some points of reference, some things to think about. Share this with some of your friends and family members. Let's get the word out. Let's get the debate going. Like I said, at the end of the day, you may have had a great result with any of these things that we just talked about, but your circumstances may be different than somebody else's, both based on the magnitude and level of aging that you're having, as well as just kind of, your response to some of these things. But on average, I think I'm right about what I'm talking about here through the experiences that I just mentioned. All right, folks. So if you have something to say, both, you want to comment below, just drop it, and let's discuss it. Let's hear about it. If you enjoy the topic, please hit like and share it with friends and families. If you want more information about topics like this, follow the Karam MD Journal, which is our newsletter, as a blog that I write. I really love empowering people to make good decisions, and it comes through your email. And then finally, if you haven't already, hit subscribe, join the family. Let's get more information like you, and certainly peruse the library of tons and tons of videos that are really designed for your education and empowerment. All right, I hope you enjoyed it. Dr. Amir Karam, until next time.